Every 40 seconds, someone in the U.S. has a stroke. May is National Stroke Awareness Month, and it's a good time to learn how to safeguard yourself against stroke. Here with more is Dr. Shawn Smith at Intermountain Medical Center Neural Institute. Thank you for being here today. We're at the beginning of the month. We want to tackle this to bring out that awareness. What is a stroke?
So thanks for having me. So a stroke, there's a few different kinds of strokes.
Okay.
But a stroke is basically a problem with blood not arriving to your brain in the right way, either because there's a blood clot that's stuck in a vessel, or because there's some bleeding or hemorrhage that's in the brain tissue itself.
So either or doesn't sound like something you want to have happen.
No, strokes can be devastating. And depending on what type of stroke people have, there's different treatment options. When people think about strokes and the word stroke, they're usually thinking about an ischemic stroke, which is a situation where a blood clot gets stuck in a vessel. All of the brain that's fed by that vessel is devoid of blood.
Wow.
And brain cells start to die. They die at about 32,000 brain cells per second.
No way. Wow. Okay, so it's significant when it happens. The longer you go without being treated, the worse off. What are those symptoms, those signs that someone may be having a stroke?
So it really depends on what location in the brain is affected.
Okay.
Sometimes people are weak on one side, or maybe have slurred speech, or they can't speak. There's actually an acronym that people use, BFAST, B-E-F-A-S-T.
Okay.
And that stands for balance, so being off balance. Eyes, so if you lose part of your vision or maybe your eye movements are abnormal.
Okay.
F is facial weakness. A is weakness in an arm or leg. S is speech, so your slurred speech, or if you can't get words out. And then T is time, and that's because it's all about time. So like I said, there's so many brain cells that are dying every second. But in some patients, if we can get them on treatment fast enough, then we can either improve the outcome, or in some cases, people can be cured from their stroke.
Wow. So you talked about time, the T and B fast being time, getting to the emergency room as soon as possible. A lot of people, they don't feel well, they want to just lay down and take a nap.
Yeah.
How detrimental is that? And what happens when you get to the hospital, when you get to the emergency department? What do they do for you? Yeah,
so trying to lay down and sleep it off is definitely not the way to go. So if you feel like you're having a stroke, or if somebody that you're around you suspect has a stroke, then you need to activate the emergency medical system and just call 911 and tell them, I think there's a stroke going on. You don't want to drive to the emergency department because the treatment actually starts in the field. So. And we'll talk about this in other segments later in the week, the logistics, but the ambulance guys will basically bring you to the right hospital, and they'll pre-notify. So we at Intermountain Medical Center, when there's a stroke patient that's coming in, there's overhead alerts that are going on, and everybody knows that they're going to be here in 7 minutes, and we have a big team that runs down there and starts that process.
So that's why it's so important to start by calling 911, get in the ambulance, get that early treatment. They'll notify the hospital, so when you get there, you can continue that treatment for the best results. Well, Dr. Smith, thank you so much for joining us today.
Thank you.